Okay, hello, and really warm welcome, everyone. Thank you so much for joining this webinar on supporting young people living with a stoma. We've got people in the audience for a range of different backgrounds, so I really hope that there's going to be something in this webinar that's, of use and of interest to all of you, regardless of your interest in this particular area. And really, we're going to be focusing mainly in this webinar on the mental health needs of young people living with a stoma. So, both diagnosed conditions, thinking about sort of depression and anxiety, but also, emotional distress, worries and concerns that don't necessarily indicate a diagnosis as such. And we're going to be focusing mainly on people who have a stoma as a result of inflammatory bowel disease. But certainly a lot of issues we're going to be discussing will be relevant to people regardless of the cause of their stoma. And I just want to flag up as well that, many of you will be used to hearing about or talking about some of these issues, but some of the things we will be discussing could potentially be distressing to some people. So just wanted to really kind of flag that up in advance so everybody knows. So I'd like to introduce myself first. So my name's Ben Saunders. I'm a senior lecturer in health research at Keele University in the Midlands. So I've been doing research into IBD and stomas for a number of years now. And this actually stems from my own personal experience. So I had stoma surgery about 10 years ago. I subsequently had my stoma reversed and I've now got an ileoanal pouch. But it's really that personal experience that's kind of fed my passion for doing research in this area. We've also got a great lineup of speakers that you're going to be hearing from today. So we have Dr. Richard Biddle from Colostomy UK, Dr. Kay Polidano from the University of Malta. We have Sahara Fleetwood Beresford and Lucy Calver, who are members of our patient advisory group for our research. But Sahara is also an advocate and a blogger and an influencer in this area. So it's great to have both of them with us. And then we also have Professor Carolyn Chew Graham, who is a GP and Professor of General Practice at Keele University. So really great, varied range of speakers. And hopefully, as I say, you'll all find this interesting and informative. So I'm going to pass you on for now to our first speaker, which is Richard Biddle.
Good evening, everyone, and thanks, Ben and the rest of the team, for inviting me along. So my name's Richard Biddle and I'm from Colostomy UK. I'm hoping some of the attendees will have heard of us. We're a national charity and we support people with all types of stomas, despite the name Colostomy UK. And we do this in a whole range of different ways. We have a 24-hour helpline, we have a Facebook group, we produce literature. We also work with support groups and we do lots of campaigning and advocacy work. Most of my time, though, at the charity is spent as editor of their quarterly magazine, which is called Tidings. So we have a readership of about 65 to 70,000 per issue. So it's quite a big undertaking for a small charity. But my role is as editor involves interviewing people that have had stoma surgery and then writing their stories and then using their stories as a way to explore some of the challenges and the concerns that life with a stoma can bring, with the hope that that then helps readers that are in similar situations. So with tonight's webinar about supporting young people living with a stoma and current challenges, future directions, I thought I'd get the discussion going by highlighting just some of the things that I've noticed that come up time and time again when I interview people that have got stomas. Firstly, I think we could be doing more to support people in the lead up to their surgery and then in the immediate aftermath of that surgery. There's lots of good quality information out there and stoma care teams do a sterling job with their patients in the hospital. But I'm thinking more here about what happens prior to hospital admission and then after discharge. And so when I interview people time and time again, people say things like, I really wish I could have spoken to somebody that had been through that before. For some people, it's about getting a better understanding of some of the practicalities of life with a stoma and how quickly they can resume what what is normal life for them, but also an equal number of people, I would say, express having more emotional needs. So quite often people will say to me, I was frightened, and what I needed is I needed to talk to somebody that actually understood that fear, with the approach to major surgery. So a big challenge, I think, is how do we make that happen more effectively and more consistently than it does at the moment? And the answer to that is one that continues to challenge us as a charity. So there are lots of considerations, I think, in play, right down to who's the right person for that patient to talk to, somebody at their own age, somebody at their own background. And even if you can work out who the right person is, how do you actually make that happen? And I think also, perhaps for some patient groups, and here I'm thinking of younger patient groups, sometimes they will say they want to talk to somebody, but they don't always mean in the traditional sense. So the kind of support that they're wanting perhaps takes a different form in their mind. So that's something that we're constantly wrestling with at the charity. And secondly, the other thing that I think we need to be as a future direction is to be a bit more creative and in thinking of ways to support people to actually get their lives back on track. So something that I've been struck by over the past few years, and I think it's something that probably people know, but don't necessarily think about, is the impact that stoma surgery has and the needs a person might have afterwards, and how these can vary according to when they have their surgery. And what I mean by that, and I'm going to use an example here, is age. So I recently spent a long time interviewing and writing the story of a young woman who had had her surgery in her early 20s. So she'd been ill for a long time, and it took a long it was a long road to establishing what the problem was. But nevertheless, despite being chronically ill, she still managed to go to university. She graduated with a nursing degree and she began her career as a nurse. But her illness progressed to the point where she needed stoma surgery. It was a protracted period of illness. She then had her stoma surgery. She then had a very long recovery period, which meant long absences from work. And it was during this period, from graduating from then to being ill to having surgery and recovery, that friends that she had graduated with from university with, they'd begun to go on to become matrons, sisters, ward managers, while she was effectively starting right at the start again. When I interviewed her, she also said that she hadn't had any kind of relationship for 10 years. So for the age that this was happening to her, that's the age where many people find somebody that they settle down with, they think about having children, etc. So in her story, she recovered physically much quicker than she recovered mentally. Her mental well-being suffered tremendously. She was suicidal with it. And so although I'm using this story to illustrate the impact that surgery can have on somebody, and it's not necessarily typical, I think it has kind of wider application. So the challenge going forward, in my view, is to find ways to support the different needs of different patient groups. And it seems to me that one way that we might consider doing that is to think about life stage when somebody's having stoma surgery. And what's happening for them at that time in their life. And that might be a different way of trying to find solutions to support people further on in their stoma journey. So hopefully some food for thought there. If anybody has the Rosetta Stone of answers, then we'd like to know as a charity. And I'm going to hand back to Ben now.
That's fantastic. Thank you so much, Richard. So I don't know if we have any questions that have come through for Richard on the chat at all. If not, maybe any of the team might have any questions for Richard or the work of Colostrum UK at all. I guess, Richard, I suppose thinking about obviously, and this is something that we've had discussions about several times, but I guess here we're thinking about research, a lot that's being done into IBD and stomas. I suppose it'd be interesting to hear your thoughts about the role of charities such as yourself in working with people like ourselves, in working as part of research, and the role that charities could play.
Yeah, I think a key way that charity, well, there are two ways actually. One, I think that as charities, we're obviously dealing with lots and lots of people that have had surgery or are about to have surgery, and so where research is involved, we can help with sourcing participants for your research, and that's something that we're actually really quite keen to be supporting. So that's the first thing, and then I think that, so Colostomy UK, we have a kind of we have a pedigree in supporting people with stoma surgery from the perspective of offering experience-based advice. So we've got well, almost 60 years we've been doing it now. So our expertise, we have a kind of collective history and expertise and knowledge, and we've got a huge volunteer base. So we've got over 100 volunteers now. All of them have had stoma surgery or have stoma still or have been reversed. And that was what I was alluding to in my talk, this idea about when somebody says they need help, it's finding the right person to give that help. And so, we can't always manage to do it, but we can, we do our best to sort of match people. So if we have a young person that needs help, we'll actually ask the question, and we'll try to match them with somebody similar age group, similar concerns. So I think that that's how we can be involved in research, both kind of as a critical eye on the research that's being undertaken using our pedigree and history, and then also as sources of sourcing participants for you.
That's excellent. Thank you so much, Richard. Really appreciate it. So I'm going to hand across to Kay now.
Hello. So thank you for joining. So I need to pop my slides on, and hopefully this will work. Can you see it, or?
Yes, I can see that, Kate. It just needs to go into presentation
Perfect.
mode. Yeah.
Perfect. I thought it was working.
So there we go.
Okay, so today I've got the very, very challenging task of condensing my doctoral study into a few minutes. So I won't, unfortunately. I do have to make some compromises, but I'm just going to take you through a bit of a tour. So basically, I started it, I think, in 2016. But what we knew at the time, what we were interested in, is lots of research being done showing that people who undergo stoma surgery experience a variety of challenges, body image, intimacy, and so on, and also that these tend to cause emotional distress. So there was a lot of research about that. Now, what I was particularly interested in, and this is follows nicely from Richard's talk, is what kind of experiences do young adults experience when undergoing stoma surgery? So, for instance, how does a stoma affect when you're entering a romantic relationship, or when you're going to university for the first time? And also, and most importantly, is how can we actually support these young adults? So both within the healthcare system and also beyond. So basically, the overarching aim of my study was to explore the psychological and support needs of these young adults. And more specifically, I was looking at, so first the experiences, but then also their views on the psychological care and support received, the views as well of a variety of healthcare professionals, and also a bit about their views on peer support and what we can do outside of the healthcare system. Now, this was a qualitative study, which means that I basically was interested in understanding people's first-hand experiences. I've interviewed them, and I've interviewed 13 young adults with a stoma, and also, as I said, a variety of healthcare professionals across the care pathway, both in secondary and primary care. Now, in terms of participant characteristics, I managed to gain quite a diverse sample, especially in terms of, for instance, how long they had been living with a stoma. One participant had just had her surgery 2 weeks prior, and some had been living with a stoma for up to 4 and 5 years, and also whether the stoma was temporary or permanent. So there was some diversity. Now, when to describe my findings, to explain them, I thought of presenting it more as a journey, because that's how the young adults viewed it themselves. And this often began well before they actually underwent stoma surgery. It started with the onset of their IBD. And a strong consensus was that this was indeed a very disruptive experience, especially, in terms of being adolescents and young adults. It's not something that they were expecting. And there was this general sense that life sort of was stopping for them, that everything started revolving around it. Now, all of the participants knew that about the possibility of stoma surgery. And all of them, understandably so, were strongly resistant to this idea, and they wanted to avoid it at all costs. And as one of my participants said, having a stoma basically was my worst nightmare. And this is because of a lot of perceptions that they had, or a lot of stereotypes. But then all of them ended up requiring surgery, both either as an elective surgery, but also as an emergency procedure. And as Richard was saying, there is a lot of distress immediately prior and immediately after surgery. What was interesting was that some participants did actually acknowledge the physical relief that the surgery gave them. So they started feeling better physically, but it took them quite a long while to actually come to terms with what was happening to them. And some even disclosed, tremendous distress. For instance, the quotation that I've got here, and this idea that they didn't want to touch it, they didn't want to change the bag, and it took them some time. And then the next step, which is probably the longest part of this journey, is learning to adapt to life with a stoma. Now, in my particular sample, which is obviously quite small, so we can't make any generalizations, but there tended to be two different kind of responses. And this is more of a spectrum. It's not a question of either or. You tend to be on a spectrum of either viewing their stoma as a restriction, so actually viewing it as more disruptive than the IBD itself. And this was the majority, that they gradually started actually realizing that there was actually something positive to be gained from having a stoma. And this is mainly due to the physical relief, which also translated into real life, into what they could do with their lives, their plans, and so on. So just to contrast these two different responses, for instance, one participant told me he was having quite a lot of issues accepting it. He told me, I feel like I can't live my life to the full. And he also touched this idea that he felt that he was too young to actually go through this experience. And whereas others told me that it's actually given me my life back. For instance, some had stopped studying at university. They dropped out because their IBD got really bad, and then afterwards they actually resumed their studies. And obviously there are a lot of issues, a lot of challenges, from body image, fear of the bag leaking, self-confidence, a lot of concerns about sexual relationships, for instance. But what is important, I think, it was a crucial it was a bit of an eye-opener for me, is this idea that both two things can be true at the same time. So you can positively adapt, you can welcome your stoma, but it doesn't mean that you're not less distressed about it. So these two can coexist, and I think it's very important for when it comes to healthcare. And finally, when I asked them about sort of what their experiences were, what were the gaps that they encountered, these were sort of the four main themes that I identified. First, this was this idea that they felt like they needed more signposting. So as Richard said, there's a lot of resources out there. There's a lot of services, a lot of associations doing wonderful work, but these young adults did not necessarily feel like they knew exactly who to go to. Then there's this idea of holistic care. So it's the idea that some of my participants did not necessarily feel that their psychological issues were given as much attention as they wanted to from healthcare professionals like IBD nurses and stoma care nurses. And they recognized that, this could be due to time constraints, structural issues, but they wanted basically their psychological needs to give them more priority. And when I was talking with stoma care nurses as well, they did identify that perhaps this issue could also be due to lack of training in identifying and managing psychological needs, and they identified a gap which could be addressed there. And finally, also the need for more age-appropriate peer support. And this is exactly what Richard has been talking about. There were instances, for instance, where young adults told me they were at the hospital and they matched them up with a 60-year-old. And it ended up being more counterproductive because, it made them feel more isolated. So that was all. When I finished, the study, I identified some recommendations which could be taken forward. And there's this first, the issue of actually we need to improve the identification and the management of stoma-related distress, address the training needs as well, and offering more age-appropriate information and support. Thank you. I will stop sharing my slides.
Thank you so much, Kay. Fantastic job in condensing a huge piece of research into a short talk. I think in the interests of time, I think we'll move straight on, but anybody in the audience, if you do have any questions or comments for Kay or any of the speakers, please do type them in as you go along. Don't wait for us to stop and ask, because we will pick them up and return to them. So please do feel free to type question in. You can see it's just the Q&A button at the top of your screen that you can use. So it's slightly different from the standard Teams meeting, but you can pop questions and comments in there. So I'm going to pass over now to Sahara. Thanks, Sahara.
Thank you, Ben, and thank you for inviting me to be here. I genuinely feel a little bit honoured, and I enjoyed the study. I enjoyed the study work that we did. So I'm basically just going to share my journey. I'm Sahara, and I've had a stoma on 3 separate occasions now. The one that I'm living with is a permanent stoma, which I had following a J pouch excision in 2018. So my diagnosis was in 2007. I was 19 years old. I'd had a sudden onset of symptoms that were only apparent for 2 weeks. And then I was admitted via A&E, and less than a week later, my colon was whipped out. So that was a hard thing to process. I didn't really have any preparation time. I didn't know what a stoma was or what it looked like. I mean, it was 2007, so I didn't have my phone in my pocket to have a Google either. So I remember my stoma nurse trying to tell me that it would look a little bit like a dog's nose, and I still to this day don't know what she meant, because I don't see a dog's nose, I see my stoma. So yeah, that was a bit of a shock. I really struggled with my body confidence, and I didn't like my stoma. I didn't like my stoma at all. I didn't like me with my stoma. It was very apparent to me that I was uncomfortable in my own body. I didn't know how to dress, so I threw all of my clothes away, and I wore jogging bottoms and boys' t-shirts for 2 years. And I didn't know that I could even tuck my bag into my trousers. So that's how I spent the first 2 years of my stoma experience, with my bag flapping around over my waistband. So I felt really isolated. I had a lot of bag leaks, burnt skin. So I didn't want to leave the house. I'd had a leak in a shop, you know, once that's happened, it's not something that you want to repeat. So yeah, very, very unhappy. I used to leave work all the time, literally just scared that a leak was coming. I'd have a little bit of an itch and I'd be like, I need to go, because the anxiety was there all of the time. And I don't feel like I got the support that I really needed. But at the same time, I didn't know who to ask for it. And I wasn't very confident in the healthcare setting anyway. I'd never experienced more than a cold before I'd been ill. So I genuinely had a colorectal surgeon and the IBD nurse and a gastro and a stoma nurse and a GP, like all involved in my care, but I didn't know who to ask what questions to. And I wasn't actually very comfortable asking the kind of questions that I wanted to ask. So I was in a relationship at the time and I didn't want to talk about intimacy. I don't think I even recognised that my mental health had took such a dive, to be honest. But none of the healthcare team that were involved in looking after me noticed either. I wanted to talk about family planning. I mean, I was only 19 at the time, but I was in this relationship and I was already fearful that these surgeries might have impacted that in some way. But if I did pluck up the courage to ask a question, it always kind of felt like they were passing me off to somebody else. Oh, you need to ask so-and-so about that. So I don't feel like I ever really got the answers that I wanted. So obviously today, if we have a question, we go on Google, we've got the internet in our pocket. I didn't even have the internet at home. So everything was just so unknown and it just made me feel more and more isolated. So I had my J pouch built in 2008 and then connected in 2009. And I was very, very certain that I never ever wanted to have a stoma again. It had been quite traumatizing for me, which I know is quite a strong word, but that's genuine. I was so sad. I was so lonely. I was so miserable. In 2012, I got a job with a local marketing agency. And I soon found out that social media was the area that I liked the most. So I started working in social media marketing. And off the back of that, I created a Twitter account, which I literally just used the search function to find people with IBD and ostomies to talk to, because these people got it. I mean, it did become apparent quite quickly that there were a lot of unmet needs between the community and that weren't being met. But it wasn't until 2014 that I actually plucked up the courage to talk about my journey as me. So actually on my Facebook page. And I think it had taken me that long. So between 2007 and 2014 to even start accepting what had happened and grieve for my own life, that I'd had my previous life, I guess. So my first awareness post went viral. So there were people all over the world, strangers, commenting and supporting. It was so sweet and so overwhelming. But it was amazing. That was the first time that I ever felt like truly seen. And there was like a community of people forming around me. So for me, the obvious next step was to create a private Facebook group. I started writing about my journey, which in the beginning, I think that was quite a cathartic process for me. And obviously other people could relate to it as well. So it was a win-win, really. And the more I learned about the community from being in it, it kind of changed what I was writing. So it did become a little bit more educational and a bit more of a place to talk about some of those important and, again, unmet needs, covering topics that people that were in the same situation as me in those early days, trying to give answers to those questions. So I'm really fortunate because now I work in the same space. I write for a stoma supply distribution company and I moderate their Facebook group, and I write for an IBD site and I moderate on their forum. And I feel genuinely incredibly lucky to be able to do that. Like, it's a really privileged position to be in, to be able to get paid to do something that you're already passionate about and that you were doing in your free time anyway. But I do what I do because I want to be the person that I needed when I was diagnosed and struggling. So I run the IBD Superheroes Facebook group. So we've provided people with a safe place where you don't need to give a whole backstory. you can ask a question and people just get it because, you know, they've got it. They've been through similar. So I was saved by people in groups. So many times people have thanked me for being there when they've needed somebody. But when I really needed them, I had a second stoma in 2014 due to some strictures in my pouch and stuff, and it got torn whilst they were in there trying to do these resections. So that was, again, a surprise. And like I said, in 2019, I was so certain that I never ever wanted a stoma ever again. And I genuinely had the mindset that I would rather die because I didn't feel like I was living when I had it. So to be able to have met all of these people and seen these people living their lives kind of gave me the confidence to think, maybe I can do that as well then. And they were all genuinely, I feel like the people in the group saved my life. And I don't know what can be more game changing than that, to be honest. But the lived experiences of people simply finding out about like support wear, meaning that I could wear whatever I wanted, that obviously helped my confidence so much as well. So I think we just live in a really amazing time. So the world that we're in right now, we can just search on the internet when we have a question and find valuable resources like that of Colostomy UK. All of the bag manufacturers and the delivery companies, they've all got blogs now. And then there's more people like me sharing blogs and people sharing on social channels and vlogs. And Colostomy UK is like Tiding magazine. So there's all this information, all of these lived experiences and bits of tips and advice that genuinely do change the game for somebody, that they're available in all these different formats. And I just think that that's amazing. By the time I had my third stoma, I think I was a lot more comfortable with the idea of my life going forward, meaning a permanent stoma. But, you know, I'd still gone looking for the information and it was there. So that's just amazing. And I, like Kay was just saying, the second and third time had a completely different experience to the first time when I was just so overwhelmed and unhappy. And by the time I had my third one, that was my chance at living rather than just existing in my own life. So my views on a stoma and the quality of life that it can give you back have obviously changed a lot. But I did also relate to the story that Richard told earlier. So because I was unwell at 19 years old, it was just, you know, all of these people that I went to school with, they're getting on with life and having babies and buying cars and buying houses and progressing in their career. And I just felt so stuck. So, yeah, that wasn't even something I was supposed to be talking about. Richard made me think about it. Okay, that's me. Thank you.
Fantastic. Thank you so much, Sahara. It's really, I mean, I just think your story is really inspirational. It's absolutely fantastic. And, you know, it absolutely highlights, you know, the importance and the value of online support, peer support, online resources that can have to people's mental health, to their well-being. And as you said, those sorts of resources and support that just wasn't available pre-social media, you know, pre-internet and so on. That's absolutely fantastic. Lucy, can I see that a couple of comments or questions for Sahara have popped up?
Yeah, so yeah, thank you, Sahara. It's really fabulous to listen to, and as Ben says, really inspirational. So we've got a comment from Laura talking about how she completely identifies with the young people in Kay's study, but also what you were just talking about, Sahara, there, and feeling that there's a real disjointed approach between struggling with anxiety and there being a lack of information, and how it's hoped that there could be something like a toolkit or something that people would be accessed to be able to explore the feelings just in an open way, either on their own or as a prompt to talk to clinicians about, which can feel really hard. I don't know if there's any kind of tips for opening up those conversations with health professionals, or whether that felt a very difficult thing to do.
For me, it was quite an organic process. I think I grew in confidence I grew in confidence as I realised that sometimes I knew my body better than they did. And I kind of felt like, do you know what, this hierarchy that I had in my head that they know all is not actually correct. And it just became every time I had a question, I wrote it down. I had a notebook that came with me to every appointment. When the question popped into my head, it was in the notebook came with me, and I would make notes back so that I didn't come away and forget, because, you know, it's very easy when you go into an appointment and get told all of these things to come away and be like, I've forgotten now. So I write things down. I write things down a lot. And yeah, the confidence literally just came in time, I think, over the journey.
And I think now we have got social media and the internet to be able to go and find information and find people a little bit more like yourself than being paired with like old, you know, like old people that might not feel as relevant. But there's a question here saying, how do you know about the quality of your information? Are there, you know, if we've got a young person, what top tips would you have for that young person finding credible information, not misleading information?
I do find myself quite often being the signposter, if I'm honest. I think normally it's the source, isn't it? So you know that there's certain trusted sources like Colostomy UK or like Crohn's and Colitis UK. And generally speaking, from what I've read, mainly the blogs and stuff on ostomy manufacturers' sites and the distribution sites tend to be quite lifestyle-y, and they're very clearly, this is a lifestyle thing. But then obviously they really want to put out quality information as well. They don't want to put things out that are wrong. So generally speaking, those sites tend to have a good quality information as well. And a lot of the time they have done a bit of patient panel research and stuff. So they've also got the input from patients, as well as clinicians tend to always read them before they go on there and stuff. So they do tend to be reputable and decent, in my opinion.
And sorry, just the last kind of question, which is quite a good point. Can you find, do those kind of stoma sites from your experience or anyone else's experience have information for maybe those that don't have a specific condition, so might have a stoma but not fit within kind of like IBD or whatever? I guess the information on those stoma manufacturers would be relevant for anyone with a stoma.
Yeah, and Colostomy UK, they're not always IBD related either. They're all for all people that have a stoma. I was going to say ostomates, but I don't know if that's a term that everybody likes. It's a term I like.
If I might just say, I mean, we don't differentiate by type of stoma or cause, you know, what led to having the stoma. So our information, you know, is quite extensive and comprehensive. So yeah.
Thank you. That's the questions, Ben.
Fantastic. Thank you, Sahara. Thank you so much, and thank you for those who have asked questions. That's brilliant. So the wonders of modern technology. Of course, we've had some technical issues with bringing Lucy Calver, one of our next speaker, in, but we're going to try and bring her in just via audio. So hopefully Lucy will be able to join us now. I can see you've come up, but I think you're on mute still.
Yeah, sorry, Ben. Just looks like she has joined. We're just trying to get her to unmute her phone, if that's okay. Should
No
hopefully
problem.
be just a button to press. Hopefully that will do that.
All of these study catch-ups we did, and we never had any technical issue like this.
No, it's always the way, isn't it? It's when you really want the technology to work that it always
when
fails
people
you in
are
some
watching,
way, doesn't
then
it?
that's when it happens.
Yeah, we can certainly, if we're having problems with Lucy, we can certainly move on and come back to Lucy. That's not a problem. Matt, if that would be better.
Sorry, I think it's working now.
Fantastic. Hi, Lucy. Thank you so much for joining. Sorry about the technical issues. I'll pass over to you, Lucy.
No, that's okay. Thank you very much for having me, despite my awkwardness with the technical issues. But yes, I'll go straight onto it. So, like I said, I've had my stoma now for 3 years. I had it back in 2020. After a short time with Crohn's. I got diagnosed at the end of 2019, and it was only mild, so we didn't expect anything. And then I just remember I had an infection and went into hospital, and when I was in, I just had a surgeon walk up to my bed and explain the surgery he was going to do. which just made me freak out. But from then, I didn't have the surgery instantly because of COVID and everything. I got sent home for a little bit to kind of build my fitness up and things, because I really wasn't well. So I ended up having it in July. But I was still, so at the time, I ended up being fed via NJ for a few months. I couldn't leave the house. I was absolutely housebound, could barely get out of bed. But I was still at the time more scared of what a stoma life would be like. I told a couple of people about it beforehand, and I just had negative stories, which just terrified me. Because I was still young. I was 23 at the time. I'd just finished uni, just gone into my first kind of, proper job. And I literally just thought, that's it, my career's over. I'm not going to kind of pursue anything. I'm just going to have to deal with this. So it was a big hit at first, and I was really, really worried. But I had my surgery, all went well. So I've still got my stoma now, and mine's actually temporary, but I've just chose to keep it a little bit longer because I'm just doing really well with it. So I'm not in a rush to get a reversal at all yet. But I think that just shows as well how different your opinion can be compared. Like, okay, other people might have bad stories, but actually experiencing it, you can really put a positive spin on it. Which is why I kind of wanted to get involved in research and things in the first place. So I just I wanted to have that input and have my say, because, like I say, I've heard all negative stories, and I mean, I've chose to keep mine for 3 years, so that's a good sign that it's not as bad as they were all telling me anyway. And also after my surgery was done in the peak of lockdown, so I had no visitors. I was in a hospital I didn't know, because I had to go to I was sent to like a private hospital, so it was more like secure for COVID wise. And so I only had the staff to help me. So it really the staff have a massive impact as well on how it goes. So like stoma nurses were all fab because they all understand it. It's what they do day in, day out. But then through no fault, it's just some of the staff, they've not dealt with stomas. I was a bit of a complex case for the hospital I was in. So they just didn't really understand the nature of it, what we have to do, things like that. So I mean, anything to kind of help get the word out there and help staff in that situation where they've not dealt with this before, if they could have something to turn to and help them as well. I got quite open with my stoma in the sense of like talking about it and stuff, just because of obviously me having my operation in lockdown. I hadn't seen, and I was obviously poorly for a few months beforehand. I hadn't seen a lot of my family and friends in about like 8-9 months, not really left the house. And honestly, I just thought, I'm just never going to see them again, and no one's going to ever know why, because of the world we were living at the time. So I made an account on Instagram saying I was having the surgery, and I got nothing but positive feedback. I had a lot of messages from people who were in similar situations and I never knew. So they, if I found out a few of my close friends from school had, one of them got IBD, a couple of like other health issues, and it helps them open up as well, push them in the right direction. That's why now I'm all for talking about it, being open about it, discussing your issues, especially with health professionals and your family and friends wherever you can, because it really does help in the accepting of having a stoma. And I mainly coped looking at other social media accounts like Sahara's herself, lots of others, and just seeing how they cope with like little things I was worried about. I realised aren't a big deal at all. Like my big thing, similar to Sahara's, it was the body image. I thought, again, I didn't know it actually stuck to my body. I thought it balanced, so I was worried a lot about it falling off. and you know, just like little things that aren't even an issue for most of us. And again, it being visible through clothes, and it's only through having it myself, and again seeing all these accounts and seeing, like, you know, even if you are a bit self-conscious, you can do just to kind of tuck it away and make sure it's all secure, and that's all done that way. But it's a long process. I mean, it's not, I haven't always been happy with it. I think it took me a long time to get where I am, and if anything, because COVID has delayed my reversal surgery, that's put me in a better position with it as well. Otherwise I may have rushed into it, but because it forced me to keep my stoma, I've got more comfortable with it over time. Still have bad days like we all do, but we get there. And I did find that in my aftercare, they were very focused on the practicality of the stoma, and it wasn't actually considered about my mental health and how I mentally coped with it. Like I said, they'll tell you how to do all of this, but it's very limited when it comes to, like, if you just can't deal with it. Obviously it's a big change. I knew mine was coming, but a lot of people have an emergency and they don't realise they're going to wake up with one. It's a big adaptation, as well as the scars that come alongside it. So my surgery was open, and I've got a long scar down the middle of my abdomen. And if I'm honest, that bugs my body image more than the stoma. But that has not been looked at. So again, another reason why I want to get involved, just to make people realise there's more to it than the bag itself. Like there's more than the bag's practical aspects, because it affects your mental health, your body image, and all sorts of different things. So if there's anything we could do to improve future services, that would just be great for everyone involved. And yeah, I think that's my story, part of my story done anyway.
Thank you so much, Lucy. It's really fantastic to hear from you. I think, like Sahara, you know, really kind of inspirational story. And I think it's really interesting because, you know, the number of people you hear talking about living with a stoma, everybody's story is unique, but there's these similar kind of concerns and worries and themes that are coming up, similar to Sahara talked about, similar to what Kay and Richard had talked about as well. So that's fantastic. Thank you. So I think, in the interest of time, I think we'll move straight on. And so I'm going to pass on now to Professor Carolyn Chew-Graham. Carolyn, are you happy to share your slides?
Yeah,
fantastic.
I'm trying. It says
we can see them, Carolyn.
See them. Oh, that's good, but I can't, which is a bit bizarre, isn't it? So fortunately, I've printed them off, so you can definitely see them. The trouble is, how do I then move them on? I'm so rubbish at technology.
You need to go on the PowerPoint presentation itself, because that's what happened to me.
Right, okay, thank you, Kay. Okay, so yeah, thank you, Ben, for inviting me to speak today, really talking about the role of primary care in supporting young people with a stoma. I think I was struck by Lucy's comments that really echoed the narratives that we heard in Kay's PhD from young people, that the practicalities were all dealt with, but young people were perhaps not given the opportunity to talk about or disclose or manage the distress that they had associated with the stoma. And I guess this is where I think primary care has a key role. I would say that I'm a GP. So I'm going to talk a little bit about where I think it fits in, but also the current context of general practice in 2023, and maybe pose a few questions about where does it fit in general practice, how can it be managed, and what, I suppose, leading into Ben's presentation about the stoma support study, how will the work that we've done help support GPs support young people with a stoma. So just thinking about the whole system that we work in as clinicians, the young person should be at the centre, and they may have family support. And I know there was a question about the need for family support, and Richard talked about the resources that Colostomy UK has for family. And then primary care is very much next, and that might be NHS 111, it might be general practice, it might be out of hours, social prescribing, NHS talking therapies, and then specialist mental health care and specialist physical care. There's obviously also social care that people can access, and I think, as we heard with both Sahara and Lucy, presentations may end up being in the emergency departments, and that probably isn't at all the place where distress is identified or managed appropriately. So, as a GP, I firmly believe that primary care does have a pivotal role in the management of and support of people with mental health problems. And the evidence is that 90% of people see their GP at least once a year. I've put a star about there because actually the rate of consultations now is about 7 or 8 times a year. And 90% of people with mental health problems are managed in primary care. Some of those may be with access to NHS talking therapies, used to be called IAPT, improving access to psychological therapies. So primary care should be where young people with distress associated with stomas are managed. But, no, before I come to the but, I will come to the positive. NHS England have talked about the need to provide integrated care. We've now got integrated care boards, which are responsible for commissioning, and they commission across the primary care network. So whilst the individual practices are important, there's also a move to, across the network, get an equality of service and service provision. We know that young people do want support for mental health problems in primary care, and certainly in some of Kay's narratives, young people talked about, yes, the GP was seen as somewhere that they could access support from. They hadn't necessarily always been offered it though. And so the evidence is that young people do want support from primary care, but they do need a trusting relationship to discuss sensitive issues like mental health problems or like stoma. And to enable that trust, they need continuity of care, so they need to speak to one clinician, one GP, and they also need unhurried consultations where the clinician, the GP, is prepared to sit and listen to the young person, giving the person time. Now, primary care in 2023, contrary to media publications and messages, primary care is extremely busy. And this is evidence from January 2023, where there were nearly 30 million appointments in 1 month. Some of those were for COVID vaccinations, but much of them were the bread and butter of general practice. And we do say that sort of 70 or 80% of consultations in general practice have a mental health component. So there's underlying distress, even if the presentation is of a physical health symptom. And actually, the number of appointments in general practice is going up. But you will be aware that there's perhaps since COVID a difference in the way people access general practice, and there's a much greater use of the telephone. There's often in practices what's called telephone first, so people have to have a triage consultation before they're allowed or offered a face-to-face appointment. But having said that, the evidence is that nearly 70% of appointments are still being carried out face-to-face. The telephone first approach is very much advocated by the Department of Health, and we know that some problems can be dealt with over the phone. But actually it doesn't suit all patients, it doesn't suit all practices, and there's no evidence that it's more effective, cost effective, it's going to save time, going to save pressures on secondary care. And so really telephone consultations should only be used if the patient and the clinician are comfortable with them. And there is some evidence for young people that actually they quite like that. There's an anonymity. They don't have to have the hassle of going to sit in a practice waiting room. But then there's other evidence that young people actually do want to sit face to face and speak to a GP who's going to listen to them. There's also another initiative which you may be aware of, and that's online consulting. So people using an online system to post a query and then getting a response, which may be, please make an appointment. It may be, I'm going to give you some advice. Please go to NHS Talking Therapies, or please look at NHS 111 or NHS website for things for advice about how to manage your condition. And I think there is some evidence that the online system is widening health inequalities. So 4 in 10 adults struggle to understand health information. They might have 7.1 adults may have a reading age below 9. And if you've got low health literacy, that's linked to poor health, but it's also linked to you being unable to access healthcare. I think we all make the assumption that young people are much more health literate and much more digitally literate than older adults, but maybe not. And there may be some young people in deprivation, they may not have a smartphone, they may have language barriers, they may have learning disabilities who can't access the NHS that way. So digital exclusion has the possibility of widening health inequalities. I'm also going to mention, because I think it's really important to note that there's a crisis in general practice in that the numbers of GPs are falling compared to other clinicians, particularly hospital doctors. And that's why we're delivering more care. But all is not lost, because actually there's a much broader primary care team. There's a scheme called Additional Roles Reimbursement Scheme, which has, I think, an unfortunate acronym, but there is funding to expand the primary care team. So we have paramedics, advanced nurse practitioners, healthcare assistants, pharmacists, counsellors, mental health practitioners. And actually it may be that one or more of these roles might play a part in supporting young people with distress due to a stoma. There is a problem across the primary secondary interface. You can't have missed the fact that there's a backlog in terms of waiting times, and that in turn is putting more pressure on primary care. But for young people with a stoma, their follow-up in secondary care is going to be delayed. So maybe pre-COVID they would have had an appointment every 3 months or every 6 months. It now might be every year. And that just illustrates the number of people on NHS waiting lists. And I think Lucy alluded to that in her talk. But I think, Lucy, you said it might have been actually a positive thing for you. That's not what we usually hear from people. So I suppose the question to everybody is, how can young people access care and support for distress related to a stoma from primary care? So it may be the old-fashioned face-to-face consultation with a GP. And Health Talk, which you may be aware of, produced by Oxford, has got really good advice for young people about seeking help from the GP, how to negotiate the gatekeeper, the reception staff, how to ask for an appointment, who you might want to see. But I think we might see that there's actually a place for supported self-management, and the GP or another person from the primary care team may help support a young person use an online toolbox or toolkit for distress. But training would be needed for the GP or for the primary care clinician involved. And I think that brings me on to what Ben's going to talk about, which is the work that we've been doing with the stoma support study in actually thinking about what a toolkit for young people would look like and what the training for healthcare professionals should be composed of. So that's my slides. Happy to take questions, and I hope I've stopped sharing.
That's brilliant. Thank you so much, Carolyn. I think in the interest of time, we might push straight on. But if anybody does have any questions for Carolyn or for any of us, please do just type those at any point, and we'll try to return to them. If we don't have chance, somebody will get back to you after the webinar. But I will attempt to share my slides now, and I hope I don't have any issues. Can everybody see that okay?
Yes.
Fantastic. Excellent. So as Carolyn mentioned, I'm going to be talking about some research that we've been doing over the last couple of years that some of you might be familiar with, looking to try to support young people with a stoma, called the Stoma Support Study. So I guess I just first of all want to kind of maybe reflect and recap a little bit on some of the things we've talked about around the challenges in managing distress in young people with a stoma, but also some of the opportunities for where we might intervene in research and where we can support people, which have really underpinned our reasoning for carrying out this research. So I think we've established and through Sahara's talk and Lucy and also Kay, that there is emotional distress. There is an impact on mental health of having stoma surgery among perhaps young people in particular. But as Kay talked about, there are these opportunities, and also Carolyn talked about, there are these opportunities for us to look at ways of how we can improve the way that distress is identified and managed within healthcare settings. And part of this, as Carolyn mentioned, is looking at how we can address perhaps some of these gaps in what professionals themselves feel are gaps in their own knowledge and training in managing emotional distress in their young patients. And Carolyn's talked about this important role of primary care, but also there are pressures and there are demands within this setting that present challenges. And Sahara talked about all the fantastic online support that's now available, but perhaps there's still a space for more age-targeted resources for young people, particularly people within late adolescence and young adulthood, that's specifically geared towards managing stoma-related distress and mental health needs. So I think it's really these, as I said, these challenges and opportunities that have really underpinned the work that we're doing at the moment. And at the moment, we're collaborating with young people who have a stoma and with healthcare professionals to design a two-part intervention. And the first part is an online resource to be used by young people. So we're specifically thinking about the age range of 16 to 35 to help them to manage and deal with the distress related to stoma surgery. And the second part, which is distinct but is clearly related, is an online training package to be used by healthcare professionals that can help them to better identify and manage distress in their young patients. And really, both of these parts of the intervention have the same goal, which is to try to improve the identification and the management of distress and try to generally reduce distress that young people experience. So I want to just briefly introduce you to the team that are involved in this, because we've got quite a large and varied team. So you've heard from myself, Kay and Carolyn. We also have Dr. Nadia Korp, who works with us at Keele University. So Nadia is an expert in literature reviews and synthesizing research evidence. And Nadia has been leading on one phase of the research that I'm going to be talking about. We've got Dr. Adam Farmer, who is a gastroenterologist who works locally in the Midlands and is also an IBD researcher. We have Dr. Tamsin Fisher, who is a researcher in mental health and has a background in human geography. And Professor Lucy Bray, who has a background in nursing and is a professor of child health literacy at Edge Hill University. We also have Megan McDermott-Hughes, who is our patient and public co-investigator on this study. And Megan, along with Lucy and Sahara and the other members of our patient advisory group, have really ensured that the voices and the experiences of people who have been through stoma surgery are really at the centre of the work that we're doing and centre of the research. And moving forward, we've got a few new members who are joining the team. So Dr. Gemma Mansell from Aston University. Gemma is a practicing health psychologist and lecturer in health psychology. Professor Leslie Dibley, who is from a nursing background and is currently a professor at the University of Greenwich. Leslie is very well known within the IBD research field. We've got Dr. Tasneem Patel, who's a lecturer in mental health at Edge Hill University. And finally, Dr. Gabrielle Thorpe, who is an assistant professor at the University of East Anglia. And Gabby is also a practicing stoma nurse. So we've got quite a nice balance of research, clinical experience, as well as the experiences of people who have been through stoma surgery themselves, who are contributing to this research. So how are we doing this, and what have we actually found? Well, the stoma support study was in 3 phases, and I'm going to talk through each of these 3 phases in a bit more detail. But we began by reviewing research that's developed resources to help young people manage distress and mental health needs in other conditions, so beyond just looking at IBD and stomas. And then we held a series of meetings and workshops with young people and with a range of health professionals to help us decide what should actually be included in the online support resource and in the training package for professionals, and then to design a detailed specification for actually what this is going to look like and how it's going to be delivered. So the first of these phases, this was what we call a systematic review, which is essentially a careful search of all the published articles that have been carried out on a particular topic, and then a summary of their findings. And the studies that we included were those that were that included an intervention delivered for people to use on their own. So, in other words, not having any guidance or support from health professionals, that would be used by young people with long-term physical conditions, and those interventions that aimed in some way to improve young people's psychological distress, their well-being, or their confidence in managing their condition. And we had, as you can see, nearly 2,000 studies that were initially included in this screening. But actually, when we whittled all of those studies down to the ones that we were really interested in, we actually only had 14 studies, that were included in the eventual review. And you can see these studies were for a range of different physical conditions. So it included IBD, but it also included diabetes, psoriasis, asthma, and others. And amongst these studies, the interventions that were developed included 4 different modes of delivery. So 8 of them were websites that were developed for the young people to use. 2 of them were smartphone apps. 2 were participants being sent text messages by the research team. And 2 of them were workbooks that people could complete either online or just with a pen and paper. And when we looked at these studies in a bit more detail, we found that just under half of these studies showed a benefit in reducing young people's distress or improving their well-being after the young people had used these interventions. But actually, there were no major differences in the features between the studies that were found to be beneficial and those that weren't found to be beneficial, which left us essentially not being sure what's needed within an intervention to make it beneficial in improving young people's well-being. So at this point, we sought advice from our patient advisory group about what they thought of the findings, and particularly what they thought were useful components that we could pull from these interventions to include in our stoma intervention that we're developing. And they felt that a website or a smartphone app would be particularly beneficial in terms of how this resource should be designed. They also like the idea of using self-management workbooks. So they like the idea of following through something in a logical order, completing different sections, and then maybe being able to save this and go back to it at a later date. They also like the idea of, rather than generic or general information, they like the idea of there being personalised or tailored information and messages that are tailored to the needs of the young people themselves. And they also like the idea of including components of psychological therapies, for instance, cognitive behavioural therapy. So we then moved on to the second phase, which we called a consensus groups. And we began here with a group of 19 young people with a stoma, aged between 19 and 34, and they focused on agreeing the content that would be included in the online resource to be used by young people. Separately to that, we had a group of 19 health professionals, and this included GPs, IBD nurses, stoma care nurses, gastroenterologists and clinical psychologists all working together. And this group focused on agreeing content for the healthcare professional training package. But these 2 separate groups followed the same process. So in each group, each person came up with a topic idea. These topics were then all discussed among the group, and then participants were given the opportunity to rate each of these topics in terms of how important they felt they were to be included, either in the support resource or in the professional training package. And then after that, those that didn't reach agreement, the participants had the opportunity to re-rate these topics and to maybe change their mind. And what we ended up with was a finalised list of topics to be included both within the support resource and in the training package. And I'm going to share these topics with you now. So in terms of the topics that reached agreement with the young people, the first of these was advice on and addressing concerns about romantic relationships, sex and intimacy. And I'm going to share a few of the quotes from the discussion about these topics. So this participant said, just small things like even when you're having intercourse, the bag, where does it go? What do you do? So these are the kind of concerns that participants were sharing. The second topic is perhaps a broader topic that was around generally receiving advice from young people with lived experience. So it was seen as important that the support resource includes the voices of people who have been through this experience themselves. So this participant said, hearing from someone who's been there, you don't know what it's like until you've had one. The third topic that reached agreement was information about fertility and pregnancy related to stoma surgery. So this participant said, this is something that there's very little information on. There needs to be so much more work done to inform young women who want to have a family. The next topic that reached agreement was processing trauma related to the illness and surgery journey. And so this wasn't just relating to the process, to actually having surgery itself, but also maybe what's come before it. So the experience and maybe the trauma that's related to either IBD or whatever the cause of their surgery may have been. And this participant said no one prepares you for processing what you've gone through. The trauma of it, and this can happen for different people at different points in the stoma journey. And next was reflecting on and recognising the person's own emotional response to the surgery itself. And this participant said you can be dealing with emotions you've never been faced with before. So it's being able to understand how you're feeling and what's caused that, whether you're starting to slip into a depressed state or scared or worried. Next was stoma hacks, or in other words, useful everyday tips for living with a stoma. So maybe things like the types of clothing that you might wear to conceal your bag, or things that you could use to make bag changes easier in everyday life. And I think maybe this goes back to a bit of what Sahara was talking about earlier, about some of these things that perhaps you just don't know when you begin this journey. And so this participant said day-to-day tips, I don't think they're really spoken about that much, but going to make your life so much easier, like knowing when to change your bag and the signs to look out for so that you don't get a leak. And finally, participants wanted the resource to include advice specifically about managing the stoma during the night. So this participant said, my stoma functioned a lot more during the night. I always had that fear of soiling the bed. So those were the topics that reached agreement amongst the young people. If we look at the topics that reached agreement among the healthcare professionals to be included in the training package, the first of these was training healthcare professionals to have some of these early conversations about stoma surgery. So having these conversations at the point when the option of having a stoma first becomes an option, and that might be months and months before the person eventually has surgery. Second was understanding crucial points in the stoma patient journey and understanding what patients or what people with a stoma are going through at that point and what their needs might be, and particularly what their healthcare needs might be. Third was helping healthcare professionals to identify some of the signs of stoma-related distress, as well as information on where they could signpost their patients to receive more support. And next was helping healthcare professionals to actually start these conversations and to hold these conversations about stoma-related distress. Some of these conversations that might be quite uncomfortable and challenging at times, and also how to support the young people to manage this distress. Next was information about physical issues related to stoma surgery, and this was particularly relating to some of the non-stoma specialist professionals, like for instance GPs, who may not have as much knowledge around different types of stoma surgery or some of the physical issues that people might face after stoma surgery. And then there was support for professionals to help their patients to adapt to living with a stoma, both in terms of social and cultural adaptation. And you can see that the last two topics, so addressing concerns about sex, intimacy and body image and discussing fertility and pregnancy, very much mirror the topics that had also reached agreement amongst the young people. So clearly showing that both the healthcare professionals and the young people were sort of identifying similar issues that needed to be addressed. So moving on from this, we then went on to hold a series of online workshops. And here, rather than separating the two groups, we had a combined group of 18 young people and professionals working together. And they focused both on the online support resource and also on the training package. They looked at the findings from the previous phases of the study and discussed the information and advice that should be included for each of these topics that were agreed in the previous stage. They also talked about what the intervention should look like, how it should be delivered, and the types of media that should be included. And that brought us on to what's represented in this diagram. So in terms of the support resource used by young people, it was felt that this needed to improve young people's knowledge and provide reassurance about living with a stoma, as well as improve their confidence and their self-efficacy and equip them with the tools, skills and strategies to self-manage their distress, as well as maybe the confidence to reach out to healthcare professionals when they do need support. And in terms of the training package for health professionals, it was felt this is needed to enhance professionals' knowledge of the concerns that young people might have, as well as their skills in identifying distress and their skills in actually having some of these conversations. So some of these difficult conversations around, you know, sex and intimacy and fertility and pregnancy, actually how to hold and have these conversations with young people. And for both components of the intervention, it was felt that this should be in the form of a website that could be accessed by young people and professionals, and that this should really be a multimedia website that includes lots of different types of features. So including, for instance, videos of young people telling their stories and sharing their advice, also videos from professionals and researchers, also simulated or role play consultations that actually show young people and professionals, whether it be a stoma nurse or an IBD nurse or a GP, actually having some of these more challenging, difficult conversations, as well as things like games and quizzes and interactive features and things that could really engage people to use this resource and to enjoy using it, both the resource and the training. So finally, just to move on to what we're planning to do next with this. So at the moment, we're in the process of applying for further funding for the next phase of this research, which is called the Stoma Support Study 2. And what we plan to do is we will be working with web developers. We'll be continuing to work with young people, with professionals, also with charities such as Colostomy UK, to build this online support resource and this healthcare professional training based on the specification that we've developed, that I just shared with you. We'll then be asking the young people and professionals to actually use it and to give us feedback, and then making changes based on that feedback. So it's really important that the people who are actually going to be using this, that their views and their experience are really central to the design of this intervention. And finally, we'll be developing plans to evaluate the stoma support intervention to see if it can actually bring improvements to the mental health of young people. And so just finally, where do we actually want to end up with this, and what's our overall goal? Well, we want this online support resource and healthcare professional training to be something that's freely available to all and that can be used both within the NHS and also outside of clinical settings. And ultimately, we'd like this to have some impact in improving the mental health and the well-being of young people with a stoma, and also to improve healthcare management of stoma-related distress. So I hope you've sort of found that useful, that sort of whistle-stop tour of really the work that we've done over the last couple of years. I'm going to stop sharing my my screen now, and I think we've actually only got a few minutes left. I'm not sure if we do have any questions that have come through about that research at all, which is absolutely fine, but perhaps we could just have a sort of a brief discussion amongst ourselves really about the next stages for this research before we finish. I don't know if anybody has any comments or questions specifically about the research or about what Carolyn was talking about to do with the role of primary care at all. Richard.
It's just a comment, actually. Kind of really struck by the stories that we heard, and also what Caroline had to say, and Kay in her presentation, just how everything matches what we see as a charity every single day. And so we've got a kind of consensus here around what needs to be done, and now it's wrestling with how we deliver that you know, the answers to that. So it's just a comment, really, but it's kind of refreshing from the point of view of a charity to feel that we're actually working in the right areas and facing the same problems. So that was all. Thank you.
Thanks so much, Richard. And I think that's probably reassuring for all of us, really, to know that there is that kind of synergy, and that we are all identifying kind of the same challenges, but also the same opportunities. And there's certainly that kind of coherence, as you say, around what you're seeing as a charity, you know, Caroline as a clinician, ourselves as researchers, and then of course Sahara and Lucy as people who have gone through this, and I suppose myself as somebody who's gone through this to some extent, but not quite the same in terms of Sahara and Lucy's experiences. But no, that's absolutely fantastic, and I think that sort of underpins the importance of us as kind of bringing in this expertise from lots of different areas to contribute to this research. Absolutely, yeah, fantastic. Does anybody else have any kind of comments or questions at all before we finish?
I mean, I imagine and I hope that any patients that have been watching today or that might watch in future, I don't actually know if we're posting this anywhere to watch later, but we definitely should. I'm hoping it kind of validates, you know, how they feel, because it's very easy to sit in your own feelings sometimes, and to hear other people talk about it. I just hope that's helped.
Absolutely, yeah, I think that's fantastic message, Sahara. Thank you very much. Excellent, and thank you for the positive comments that we're getting through on the chat as well. That's very much appreciated. Fantastic, excellent. Does anybody have any further final comments before we wrap things up? No, excellent. Well, this has been really fantastic. I do want to say thank you so much to all of you for contributing to this webinar. It's great when we can kind of come together in this way and hear from lots of different perspectives that are either working in this area or, you know, obviously, you know, have lived experience of this area, and to kind of bring that all together in one place, really, and kind of have a shared goal as well is absolutely fantastic. And of course, the research that we're doing is not the only research that's being done in this area, and there's a lot of fantastic work that's being done both in the stoma field, also in the IBD field. And I think yeah, absolutely, it's important to kind of showcase this research and get it out to as wider audience as possible. So that's absolutely fantastic, and I think hopefully we will be able to share this more widely with people who either haven't been able to attend or people who are interested to hear afterwards. But I'd like to say thank you to those who have attended. Thank you so much for joining us and giving up part of your evening. I do hope that you found this interesting and informative, and if you do have any further questions or comments, please do feel free to email myself or any of the other speakers, and do get in touch with us. I think we might have had one more, is it a comment or a question come through on the chat there, Lucy? I can't quite see the bottom of that.
It's thank you so much. So we've had 3 people saying thank you, really important research. So we really appreciate those comments, because it is important for us as a research team to know that we're on the right track, and we need to get some funding to take this further, I guess.
Absolutely, yeah, fantastic. And I think, you know, hearing these messages of how important this work is, it lends further support to us gaining further funding for doing this research. So actually hearing from people, particularly people who have been through this experience, that this is worthwhile is incredibly important and you know, very important. And also we're always looking for people to get involved with research. So that's another thing. I think Lucy and Sahara talked about the value of getting involved with research in this area. So again, if that's something you're interested in, please do get in touch with any of us as well. So I think we'll, sorry,
as a
Caroline.
research team, we couldn't do it without people like Sahara and Lucy. I think their input has been so important, and you know, yeah, so you might have got something out of being involved, but we've certainly got loads, so thank you.
Absolutely. And I think Sahara and Lucy, obviously you contributed to this webinar, but Sahara and Lucy have been contributing for the last nearly 2 years on this study and have given incredibly valuable input. And also look out for more, because we're going to be doing some more work with Sahara and Lucy in the very near future that will be coming out as well. But I'll leave that.
They don't get rid of us that easy, see.
I'll leave that as a bit of a teaser. So yes, thank you very much to all the speakers. Thanks to those of you who've attended, and we will bring things to a close now. Thank you very much.
Thank
Bye
you,
all.
everyone.
Thank you.